This is Jackie. Hi, Jackie.
Hi.
Jackie actually came in about 3 or 4 weeks ago, and she has had chronic low back pain. We've done an MRI on her back. She's been suffering from low back pain, Jackie, for how many years?
Oh, several.
Several years. An MRI scan was done of her back probably 2 or 3 years ago. We saw that there was ruptured and herniated discs in your back, correct? And I just mentioned to Jackie that we purchased a new piece of equipment, and it's the FX 405 laser. And this laser has been used in level 1 clinical studies, and it's the first and only laser in the world to be given FDA market clearance for the treatment of chronic low back pain. And the average patient treated had a 58% reduction in their chronic low back pain. And the patients who received the FX treatment had a 42% decrease in pain after 4 weeks, 8 visits, 4 weeks, 1 month. And after 1 month of treatment, post 8 visits, their pain level decreased from 42% to 53%. And then another month later, it decreased again from 53 to 58% decrease. And this was a cumulative effect which continued to decrease the patient's pain. And my understanding is from Acronia, the company, that they did follow-up pain evaluations on these people in the study, and they had continuing decrease in pain even up to 12 months after, so even greater levels than 58% decrease in pain. So Jackie is actually the first patient to go through this trial with our new piece of equipment. Jackie, could you just share what was going on with your back pre-laser treatment, and now you've had your 7th treatment as of today? Could you just share what's happened?
Pre-treatment, I was having difficulty walking and pain most of the time. It was wanting to go to the right side and be a little selective in terms of where the pain was located. And it was slowing me down. I didn't like that. I like to be up and moving around. And when Dr. Joe offered this,
Specifically slowing you down in what ways? Could you be a little more specific?
I didn't. With the pain, you just don't feel like you want to move as much. And so you just kind of find yourself moving less and less, which is not fun. And then when you do want to move, it's not comfortable. And so I've always enjoyed hiking and walking and doing a lot of things like that with my family, and it was impeding that.
Okay. So you've had 7 treatments. What's transpired?
Oh my goodness. The difference is something I would never have anticipated. The first treatment, I noticed that the pain was decreased, and it lasted for the duration of the time between appointments, and it's just been getting progressively better. I was having difficulty going up and down stairs and lifting my right leg in particular. And I didn't know if that was related to the stroke or just to the muscle pain or a combination of both, but it's remarkably different now.
What percent improvement would you say you've had? Best guess. I mean, compared to where we were at 3.5 weeks ago or so, and where you're at now, what can you quantify it at all, or is it too difficult?
It's a little bit challenging to quantify a percentage of improvement, but it's markedly better. I mean, it is so noticeably better. I'd say it's easily over 35%, probably closer to 45%.
Great. Jackie, anything else you'd like to share regarding the process? Was it painful?
No, the process is very relaxing and just amazing. I would suggest that anybody that's running with low back pain give it a try. It's a non-invasive form of treatment that has produced such great results.
Do you mind if we check in a couple months and see if you've noticed any continuing level of improvement?
Sounds good.
Great. Jackie, do I have your permission to share your story
Yes, you do.
with doctors, students, or patients anywhere?
Yes.
Any restrictions on that?
No.
Thank you, Jackie.